And very often I get asked this question by trainees or maybe consultants about what is an ESD. And I just borrowed this vignette from this publication of my esteemed colleagues, Brian Saunders and Zach Ziamoulos, that I think represents very well the difference between an EMR and an ESD, or how an ESD should be done. When we place a snare across a polyp from the surface of the polyp, most of the times the resection is quite superficial into the submucosa, and we want to do that in order not to cause the complication of perforation. So very often we are quite shallow. Whereas when you perform an ESD, you should aim to peel off as much submucosa as possible, so be quite right above the muscle layer. So if there is a chance of submucosal invasion and is superficial, you are giving the chance to the patient to have a curative treatment. And you are going to see a video that it was a 2.5 hours ESD that I've done the very difficult task to try to condense it to over 15 minutes. And sometimes if you are not familiarized with ESDs, it's a bit difficult to follow the sort of the script of the movie. So these are very simple vignettes that I'm going to give you now to highlight the different points of the video that we have. So first of all, what we are going to do is, in this particular case, I'm going to use tunneling technique because I'm using the Speedboat Ultra Slim, and tunneling technique works very well when you use this device. So we will mark the lesion, first of all. Then we are going to do an incision on the proximal gate, so open a proximal gate on the oral side of the lesion. The next step is going to be opening a distal gate on the anal side of the lesion. And then once that's happening, I'm going to be traveling beneath the polyp, creating a tunnel until I meet the proximal gate I have opened initially. Once that's done, we will tackle one of the side circumferential areas, then we will move to the other side, and hopefully then we will have the lesion completely removed.